straight from the heart of East Tennessee. This is 10 News at 5.
Well, it's easy to think the fight against breast cancer ends once a woman has had treatment and they're cancer-free. But for women who've had a mastectomy, construction is the next step. There are many options out there for patients, and here to talk about some of them is plastic surgeon Dr. Jay Lucas. Dr. Lucas, thanks for being here.
Thank you.
Do you think women are aware of, I guess, the choices that are out there for them once they've had their breast removed?
Well, unfortunately, based on our society's data, about 110,000 women per year get a mastectomy, but only 30% or 70% were not given information on reconstructive options. And if we have our choice, every patient should see a plastic surgeon even before her mastectomy to decide whether we would do it as an immediate reconstruction or as a delayed later on down the road. And
what is the value in the reconstruction? Not just physical, but I think it has to go beyond that as well for the individual.
Well, certainly. I mean, when you think that some cancers internally don't leave you with a disfigurement, certainly a woman's breast has many implications, and a woman can feel very vulnerable after losing a breast.
Most definitely. Well, there are many, many options out there. One that's relatively new, a new product that you are using when it comes to breast reconstruction. It's called Alloderm. First of all, what is it and how is it used and what makes it so great?
Well, it's mostly used for implant-based breast reconstruction, and it's particularly beneficial in immediate reconstruction where we are trying to have coverage of an implant. Historically, the implant was covered totally by muscle,
right,
and that led to aesthetic problems of being underexpanded in the lower part of the breast, overexpanded in the upper part, and the fold had a lack of definition because the expander would be here, and a lot of times it would ride up.
Right.
Alloderm is derived from donated human tissue.
So this is donated human tissue that has gone through a process, right?
Right. They reprocess it where they strip away all the unnecessary elements, and some of those unnecessary elements lead to graft rejection. So basically it leaves behind a scaffolding, and when you think of scaffolding, think about when you build a skyscraper and you see these big metal girders.
Right.
What this has in our own skin are these protein complexes that are like these big steel girders, and that is what's left behind in this processed tissue that provides thickness, support, and allows the implant to be covered in the lower aspect and only covered in the upper aspect by the muscle, and it allows you to have more expansion in the lower part of the breast and less in the upper, so that it is a more smoother contour, and it gives a much better aesthetic result.
I was going to say, you've been doing this a long time, and you have to be pleased with the steps that are being taken as far as improvements in doing your job.
Right. I mean, nationally there's been over about 1 million Alloderm cases for breast reconstruction. My series in Knoxville has been about 300, and it has led to a far superior result. And also for revisional work, a lot of women come to me for revising what's been done elsewhere, and it provides a means of adding thickness, providing ability to lift the implant if it's too low, and stabilize it in its position. It just looks more natural.
All right, Dr. Lucas, thank you so much for this information. Fascinating stuff. Love to have you back again sometime.
Thank you very much.
All right, stay with us. We'll be right back.